My name is Matthew Ohr, and I'm dual fellowship trained in both retina and cornea. I grew up in Cincinnati, Ohio, in a small town called Madeira, and I did my residency training here at Ohio State. In my third year, I was elected as chief resident. After that, I did a fellowship here in cornea for 1 year. Following my training, I went in private practice for 2 years at the Cleveland Clinic. I then had an opportunity to pursue a retina fellowship, which I did at the Cleveland Clinic. I started thinking about medicine when I was in junior high, and I initially wanted to go into medicine and be a pediatric doctor. I enjoyed working with children. As my training went on, I realized that I just enjoyed working with people in general. I went into ophthalmology and specifically into cornea initially because it allowed me the opportunity to make a pretty impactful change in people's lives. When you do cataract surgery or you do a corneal transplant, you really have the opportunity to improve someone's vision in a pretty immediate fashion. My interest in retina stems from the fact that retina patients tend to have other medical conditions, and taking care of them allows me to fully utilize my training as a medical doctor. Ophthalmology really is a great field, and the reason it's a great field is because with your sight, which is one of the most important senses we have, it really is something that when you lose it, you comprehend how valuable it really is. And we have been very fortunate as a subspecialty to be able to help a lot of people. We don't just diagnose diseases. We have many treatments available to us to improve vision. OSU Medical Center really is an amazing place. We have a vast array of resources available to us as physicians, and it really makes us the leader in the region for a lot of the diseases and techniques for our patients. One of the benefits of being here at Ohio State is that we get access to the clinical trials that are happening. We have the ability to provide patients care that they may not be able to receive anywhere else. And so I was excited to have an opportunity to come back here and bring my training with me to be a part of this medical center. So most of the research that I do focuses on state-of-the-art surgical techniques as well as ocular imaging modalities. Primarily, I'm interested in optical coherence tomography, which is an imaging technique for the retina, and it allows us to see the retina in detail that we couldn't otherwise see. My number one focus with patients is the patient. Whenever I do surgery, I look at that patient as if they were my family member, and I do everything I can to make that as comfortable for the patient as possible. Surgery can be a very scary thing, and so you want to be able to have an open line of communication with your physician, and that's what I strive to achieve. So as someone who's had a lot of training, I understand the value in teaching and be a part of creating the next generation of physicians who will be providing care for me and my family. Getting to meet people and being a part of their lives is the most rewarding part of what I do. And nothing matches the feeling that you get as a physician when a patient comes in and they're not able to see, and you're able to provide a treatment, whether it's a medication or a surgery, that improves their vision and ultimately improves their lives.